To mention to you, we are tomorrow 32 weeks or 16 incubation cycles since the first case of COVID was identified in Pitt County. At this point, we have accumulated 6,113 cases and 38 deaths. Our case fatality rate remains stable at 0.6%. The last 14 days, we have seen 576 new cases. Our estimated recovered stands at 5,498, and we would estimate there are currently about 576 active cases in Pitt County. Our testing percentage of positivity is at 6%. Kind of has been floating around 6%. There's a couple of points above. We were 5.9 yesterday. It floats a little bit. And right now we would estimate there are about 3.2 cases per every 1,000 Pitt County residents. So with that said, I'm happy to take your questions. I don't know who's here first, but I'll start on my right.
Okay. So given that we are entering the end of the year, we've got holidays coming up. Obviously, Halloween is this weekend. We've had plenty of presidential election campaign rallies. Can you give us a projection on whether you think that we're going to have a spike in positive case numbers soon?
So far so good. We have not. Tomorrow would be 2 weeks out, I think, from the Trump rally, and our numbers have remained relatively flat. Again, I think if you look at for the Pitt County epidemic curve, and when you look at that data, please look at it by date of test and not data report. The data report tends to skew it because reports get clumped and come in, and we know sometimes, especially with antigen testing, it's lagged. But look at it by data report, and you'll see that we're relatively flat on before the ECU bubble or spike, and then we're relatively flat after the ECU spike. I would argue the same thing for the state curve, that yes, we went over a peak, we came down into a little bit of a valley and went up. And I would argue that is the undulation of a flattened curve and not truly new waves of infection, that this is an ongoing, in that first wave or that first flattened curve. So to date, no, we have not seen a spike. Would we anticipate that there may be some increased activity after Halloween, after Thanksgiving, after Christmas? Sure. I mean, we see that with flu. One of the things that we are seeing is that people, come together, and when you're with people that you're comfortable with, we let our guards down. So as we celebrate Halloween and we look forward to celebrating Thanksgiving and Christmas and New Year's, remember that folks that you don't live with potentially can have COVID, and be careful about letting your guard down, even around extended family members, because not only did they bring the potato salad to the cover dish dinner, maybe they brought COVID to the cover dish dinner too. So just something to think about.
Okay. And then I saw this morning, ECU offers antigen testing for anyone who doesn't know the difference between antigen and antibody testing. Could you explain that a little bit?
Mm-hmm. Sure. There are really right now about what we would say 4 different types of tests out there. There's the traditional PCR test, which was the first and really remains sort of the gold standard for COVID-19 testing, and that is the deep nasal swab or nasopharyngeal swab. Some of those are done by just an anterior nasal swab or oropharyngeal swab, but what we call PCR testing, which looks for the genetic material of the virus. There is what's called an antigen test, which looks for a protein from the virus, and that is marketed or manufactured in what's called a lateral flow assay, and uses antibodies to detect that protein from the virus. So those are good in people who have symptoms of COVID-19. If it's positive, very likely that person has COVID-19. If it's negative, they still may. So negative tests, right now the guidance says should be backed up with a PCR test to see if that person does have COVID and that you got a false negative antigen. There's what's called a rapid molecular, which is a point of service molecular test. That is also a PCR test, but it is run on site, and it does not have, to get speed, it gives up a little bit in sensitivity and specificity. Still a pretty good test, but there are reports of false negatives with some of those systems as well. And then finally, there's what's called antibody testing, which looks for our antibodies. So if you take a person who may have been infected or is known to have been infected with COVID and measure the antibodies to the virus in them, antibodies would suggest that they were infected at least 3 to 4 weeks prior to that antibody test.
Okay.
And those are the 4 different types of tests that are out there.
So just to make sure that I've got this right, the antigen test is similar to the PCR. It's just, like you said, looks at the proteins.
Mhm.
So somebody could get the antigen test in lieu of the PCR test?
We use, the antigen tests are recommended to be used only in people displaying symptoms of COVID.
Okay.
And if it's positive, then that's considered as good as the PCR in a positive test result in someone with symptoms. If it's negative, then that should be backed up with a PCR test. The PCR test is still the gold standard in COVID testing.
Okay.
Okay?
And then lastly, if you could just speak a little bit on how you think it's going to continue to go as far as mandates, social distancing, mask wearing. I know it's been a long time since the beginning of all of that, so people are getting a little stagnant in their ways and kind of not being as keen on wanting to wear masks, social distance, etc.
Yeah. The more time you spend around something, the more comfortable you will be with it. I said to my wife yesterday, if you spend enough time around plutonium, you get comfortable with that too. You know, plutonium is a very radioactive isotope. So we encourage everybody to be mindful of their social distancing, to stay 6 feet away from folks, even with folks that you're relatively comfortable about. Wear your masks, wash your hands, and please, if you're sick, stay home. That's the other thing. So many of the clusters, these little outbreaks and exposures that we have go back to somebody coming to work or going to school or sending their child to school when they were sick with what might have been COVID, or sometimes even what they know to be COVID. So please, if you're sick, stay home.
Okay, thank you.
You're welcome. Thomas?
Approaching 2 weeks out from the big Trump rally, which is one of the largest events we've seen here past couple weeks. I know you said things have stayed pretty much level in the county since then, but can you nail down definitively any contact tracing efforts back to any positive cases back to that event?
To my knowledge, we have not identified any cases that are linked to the Trump rally. That would be very difficult to do sometimes because if you're in a group, how do you know that you were exposed? But we have not clearly identified anybody that's become positive because they were at the Trump rally.
How about any of the other events that have visited town recently? I know Doug M. Hoff was here for the Biden campaign, and a couple of other smaller things. Any other events that you can link cases to?
Yeah, same thing. Have not clearly identified anything linked to any of these political rallies on either side of the aisle.
That's me. That's it for now for me.
Okay, and I always say the best for last. How's that? Just kidding, guys. Just kidding. Elizabeth.
So Halloween's this weekend. How are you expecting large gatherings this weekend with Halloween?
In what segment of the population, I guess?
I guess college students.
I think there probably is a tendency for college age students to gather. Right now, the rates on ECU students in town are very, very low. I believe she's had 1 or 2 cases a week since the big spike. So that doesn't mean that they should go out, because there may very well be folks who are carrying it. Again, anytime you bring people together and there's a communicable disease circulating, it's possible for that disease to be transmitted. So again, celebrate Halloween, but celebrate responsibly. Wear your mask, stay 6 feet apart. Be careful who you expose yourself to. Don't drink out of somebody else's glass or bottle, things like that.
Okay, so people should socially distance, not share drinks.
Mm-hmm. And wear their masks.
Wear their masks. And could we potentially see another ECU bubble after Halloween?
After Halloween, I suppose so. College students think they're invincible. The only problem is you only stay 20 in bulletproof or 18 in bulletproof for a few years, so it doesn't last forever. I suppose so. I'm hoping not. We know there's far fewer. A number of the students have gone home. The students are spread out. They're much less dense than they were when the college originally opened back in August. So we may see some increased activity. We may not. The 18 to 24-year-old age group is still our biggest group in our data, but that has shrunk some over the past few weeks. The 25 to 49-year-old group has been catching up right now. I think the 18 to 24 are 36%, and the 25 to 49 are 32%. It's about a 4% difference in the two groups. And that's probably that the more of the middle-aged working adults are catching up.
Okay, that was my last question.
Okay.
Would you say that that's contributed to the fact that ECU students have gone home? Probably most of them have probably gotten COVID during the ECU bubble,
Mhm.
and it's kind of died down. Why do you think that the working class age group is kind of catching up now?
Well, I think there's not as many college students here, not as many college students getting the infection. We've worked very diligently with ECU to work on a campus-based contact tracing. There's been ongoing testing on the campus to identify it. They've got a surveillance plan in place looking for new cases. So if they do identify a case, they can rapidly get that case isolated. They can get the exposed to quarantine, so that has helped with control on the campus. That 25 to 49-year-old age group, that working age group, those are folks that are going out working every day. And eventually somebody does, they run into a customer or they run into a coworker that has the infection and they acquire the infection. Interestingly, I would say we have not truly, outside of a child care center, not really identified a cluster in a workplace. We've identified sporadic cases in various workplaces, but we haven't identified where, John brought it in and gave it to Sally, gave it to Mary, and on through a company so much. So we haven't seen that cluster in workplaces. Where we have seen clusters are private functions again, birthday parties, barbecues, baby showers, things like that, where people let their guard down because they're comfortable with each other. And the same thing happens in employee groups sometimes where, I spend a lot of time with Kayla, our offices are across the hall from each other, so I get comfortable with you and then I happen to bring COVID to work or you bring COVID to work and we give it to one another. So again, be careful about that. Be mindful that even the folks you work with may bring COVID to work and not know it.
Okay. And then lastly, speaking on the bar situation downtown, obviously now most bars have opened up in the downtown area. What would you say about that situation in terms of case numbers? I know people are going in there socializing, masks off, we're drinking, we're in close quarters.
Mm-hmm. I would say that is a higher risk activity to partake in, and people should. I don't want to ruin anybody's business. I want to say don't go have a drink somewhere, but have a drink responsibly. Again, wear your mask when you go into the place. Take your mask down to drink. When you do meet with others, if you stay 6 feet apart. This is. We need to think about this more like a fire. And, the fire can only move so far if you keep the fuel. We're the fuel for the fire. People are the fuel for the fire. If you keep the fuel apart, the fire can't move from one piece of fuel to the next. And so even in a higher risk setting like a bar, if the fuel is far enough apart, the fire can't spread. Okay? So.
Clearly the Halloween guidance, especially as trick-or-treating goes, is to keep kids from, touching the same stuff over and over, buckets of candy, what have you. But, that's the kind of thing that happens in grocery stores. People are not, told not to pick stuff up unless they're putting it in their carts. You pick something up, you put it down. Is there something that separates or, sets, one situation apart from the other as far as, kids are advised not to pick stuff up and put it down? Why isn't that situation applied broadly, I guess?
Yeah, early on in this, we thought that the contact spread was much more important than it probably is, Tom. So contact spread is where, I cough, I leave respiratory droplets on a surface, you touch the surface and you get infected. And that was thought to be much greater early on. I'm not saying that doesn't happen. I'm saying that's probably less of a means of spread. It's more about me directly exposing you to my respiratory secretions, be that coughing, sneezing, talking, that sort of things. The surfaces, the virus in terms of living on a surface probably lasts for a few minutes and not prolonged periods of time. Yes, there are some studies, this can be out there long ago. And we've talked about that. A lot of times when they do environmental persistence studies, they do a wipe sample of a surface and then they look for the genetic material of the virus. And that genetic material can be there for sometimes days or weeks and still be definable in some of these PCR assays, these polymerase chain assays, which amplify a small amount that's there to make it measurable in the assay. And it doesn't mean that there's living virus there. Just because I can find it on a wipe sample doesn't mean that there's living virus there. So yeah, the thought of kids, repeatedly putting bowls, if you are going to serve treats to kids, you should be handing them out to kids. The risk of spread from a candy wrapper would be very low. The same thing with groceries in the store, you know. A can of soup in the store that you purchase and take home, very, very unlikely that you're going to get COVID from a can of soup or a can of beans or some other product in the store. You know, it would have to be fairly fresh. We know ultraviolet light rapidly kills the virus, and we talk about maybe, you know, a minute and a half as a half-life of the virus in you know, sunlight kind of thing, ultraviolet light. So if you got to go through 5 half-lives, that's about 7.5 minutes for that virus to be dead. The drive home for most of us is probably more than 7.5 minutes. You know, so if it was on there, it's probably dead by the time you get home. So contact spread, I won't say that it doesn't happen. I would say that it's less important than it was originally thought. And the same thing would be true of Halloween candy. So if I had COVID and I did leave some COVID on a candy wrapper and put it in the kid's basket, by the time the kid gets home and actually gets to eat that, the virus is probably not alive, not still active.
Some of those guidelines to, you know, pass it out one at a time is more of just keep that candy from being a surrogate for people to crowd around and.
Yeah, you know, if you put a bowl of candy on the porch and the kids all gather around it, again, there goes your social distancing. And while sure, if a kid's got COVID on their hands and they contaminate the bowl, could somebody else be contaminated? But that's going to happen fairly quickly. That's going to be, you know, I got it on my hand and I touched my eye, or I you know, licked my finger or put my finger in my nose or something like that, so that I self-inoculate that virus. It's got to happen fairly quickly. So again, if you are going to hand out treats on Halloween, hand them out. Don't just set a bowl out on the porch, I think would be the best advice. Okay?
Thank you.
All right, thanks, folks. I'll have to go to Elizabeth first next week.
Thank you.